Wow, we have such a big group today. I'm so excited. Thank you, everybody, for being here. I thought like with the weather, maybe we would get no one. So this is fantastic. We have so much to talk about and a lot to be celebrating. So I'm excited to jump in. I'm going to let a couple more people in because it's really just 12 o'clock. Everyone was super timely today, which is great. And I also see a lot of new names popping up on my screen. Obviously, a lot of folks I recognize too. But this is great to have new people on board. I'm going to kind of jump right in to where we are in the budget process, which is we are currently in front of the Senate. So if I'm jumping, to a place that you are not familiar with yet, definitely feel free to follow up with me after. If this is new to you, because we are, midway through and I want to catch everyone up on where we're at right now, but I'm happy to go through, a little more of the basics with anyone, that feels like it wasn't clear enough today. Okay. And I see that I'm gonna okay this. Okay. So letting a couple people in. But thank you again, everybody, for joining us. Oh, and here's Jose. That's great. I'll wait for Jose to get on and give his camera. Hi, Jose. Thanks for joining us. All right, I think we're going to get started. We have a huge group today and a lot to cover. So I'm going to just jump right into sharing my slides, which are pretty much ready to go here. We'll start from the beginning. Okay. All right. So thanks for joining us, everyone. I'm going to take you through a little bit of our legislative advocacy priorities, and the update being really about the Senate budget right now. But I did put just my name on here, but I also have Jose Lopez with us today, and he's going to jump in and talk a little bit about our bills when we get to that section. And my date is way off, so ignore that date, please. All right, so we're going to cover the legislative advocacy results of the House budget that just finished. And the good news is that they kind of maintained and met our ask, which was really to support a historic budget investment from the governor on our workforce, and many other areas of DDS. And also some other great investments. So we'll talk a little bit about that. We'll talk about, why we need these investments and this funding, and give you a little bit more around the messaging that we're continuing to do with the Senate. And then talk a little bit about strategies right now for how you can make a greater impact on your senator. And then, as I mentioned, Jose will and I will review some of the top priority bills that are currently, I guess, viable is the best word to use. And things are kind of changing rapidly with that right now, because many of our bills were in extension and just being released today, or getting continued extensions, or getting put to study, which means, their lifeline is over for this session. So we will have some news today, but it will continue to evolve. And then we'll have some time for Q&A, and hopefully somebody can also check the chat for me. And for some of the new folks that are on, I just thought, we could start with a little bit about what the ARC's real focus is. And, I've been at the ARC for about 13 years, actually, but 10 years. I've been on Beacon Hill and advocating for the budget and for legislation. So those are kind of the two main areas we're going to talk about today. We also do a lot of work on policy, obviously mass health and empowerment, which is really what we're doing today. We also have programs that you're probably familiar with, one of them being Operation House Call, which is actually part of this budget. So we'll talk about that a little bit as well. But really the goal, my goal and my government affairs team's goal is to amplify your voices at the State House and to try to build those relationships with our legislators and leadership over time and make those connections for you to do the same. And I talked a little bit about our messaging and, you know, kind of why are we pushing so hard for these workforce investments and to make sure that the House and the Senate uphold all of the DDS increases in our line items. And it's because we're still in, you know, a very serious crisis. And, you know, crises are supposed to be short term, and this is not short term. We're you know, 4+ years in for some folks. Over these years, we've seen, you know, closures of programs. We've seen thousands of people, and we still have thousands of people who are unserved currently, adults, in our community. And I think you all know what that means for the individual. I mean, no services and supports or minimal services and supports means more isolation and possible regression. It's you know, puts huge amount of stress on caregivers. It has an economic impact, and we really need the legislature and the governor to help us turn this around. Hopefully through this pretty substantial increase in a workforce, human services workforce rate. So we're looking for that rate to get up closer to a bottom line average of $20 per hour. And that is what the House was able to do for us this session, this part of the budget. And so just making sure everybody knows exactly where they need to go to contact their legislator. I would say, you know, if you don't know who your legislator is, you still can go to the arcofmass.org and check on that. And you can also use malegislature.gov. Sign up for Notes from the ARC, because that's where you will see all the action alerts relative to the budget and to our bills. And we'll talk much more about the importance of those action alerts, but also how you can make them most effective. But make sure you're signed up, you know, and follow us on social media. That helps too. So I know all of you are doing this. You're checking in with your legislators. We just had our two big events at the State House, and so many of you were there and made connections with your legislators and their staff. But we talked about some other options now. You know, there's a lot of options to reach out and meet with your legislators in the district. There's still Zoom options for many. If it's not with the legislator, sometimes you can Zoom with their staff. But one of the things we've been talking about, and it makes sense to us to do right now with the Senate, is if people are interested, to really try to set up a meeting with your senator in your district. Make it a coffee meeting, maybe meet for lunch at a local restaurant, and invite 4 or 5 families who are advocating for the same issues, who understand the need to get this budget through with these increases. And we can actually help you to connect to those families in your district through our action alert system. So we know we can look at every senator and see how many people in that senator's district have sent letters, and we can connect you all. So that's something I think Jose is going to jump into now and say, you know, there's power in numbers. If you guys can kind of get together and then go to your senator and say, hey, there's 5 of us, we'd really like to talk to you. I can bet you that they would be willing to do that in the district to make it easier. Or, you know, or by Zoom, and that, you know, when the numbers are that high and they know that it's that important to more than a few families in their district, I think you will see interest in that. So again, those action alerts come in really handy because we can see, and we thank you very much, we can see how many people are doing those consistently, who are our top action alert folks, and we can connect you and sort of make a power group, right? But you know, just to mention again, you know, if you send those action alerts, the real power in that is the follow-up. So you're gonna send the alert, you know, read it, know what it's saying to your rep and senator, customize it if you want to, but the real power is then following up to say, I sent you an action alert. Were you able to do what I asked in that alert, which was to, you know, support this budget, you know, or support these line items, and it's all written out in those action alerts. We are so excited because we just put our action alert out, I think Monday, for the Senate budget, and we have already over 400 letters sent, which is actually like, I think double what we got for the House right away. So people are engaged right now, which is great. And your senators are definitely feeling, you know, those letters coming in, and that follow-up is key. All right, so I think I really said enough of that. Yeah, so 422 letters, and this is what the action alert page looks like. So let's get that up, like, you know, today over 500, and then we have some time. We're going to be, you know, working the Senate budget for the next couple weeks. So share this with your networks, and I don't just mean your disability networks. Share this with your entire community. The more voices that weigh in here, the better, and it does not have to be just our disability community. It can't be, actually. We have to keep moving beyond that. And so I think you all know that that the Senate Ways and Means Committee has the budget right now. And so affecting leadership, the way we do that is right through your own senator, right? So the more you're talking to your senator, the more you're writing your senator, the more likely they're going to bring your issues right up to leadership. And that is, you know, the Chairman Rodrick's, and Senate President Karen Spilka. If one of these folks are your very own senator, then you're really lucky because you're talking right to leadership. But most likely we're going to be working that funnel of, you know, kind of pushing all of the senators up to leadership to say, these are my priorities. And they include the disability community. So we've been talking a lot about the importance of sharing your story. You know, if you're a family member, if you're a professional, and you are feeling the effects of the workforce crisis, it's really critical that we're sharing the stories. You don't have to share your entire history of your loved one, but the impact of this workforce crisis on services, if you're a professional, what you're seeing, you know, or as a family member, what it's really doing to your family, or, you know, the families that you know and are a part of this community. One of the things I think we talked about actually this past weekend at our transition conference is that it's not always easy to put your personal story out there, and that people feel very challenged by a kind of not being able to ensure the response from the senator or their staff. And I totally understand how hard that is when you put your personal story out there and you don't get a response, or maybe you feel like it's not as important as it should be to them. That can be really hard. And I think it takes some time really to build trust with your lawmakers and their staff. So, you know, even though I'm always saying push out your story, you know, take the time you need to build that relationship and to feel that trust, whether it's with their chief of staff or their, you know, legislative director or the senator or rep themselves. But eventually that's what we really want to get to is letting them understand what's really going on the ground in our families with services that need their support. And then it's a little bit easier to hold them accountable, right? Once you've been able to share your story and share the need. All right, so now we get to review the 2025 budget that the House just passed, right? So if you look at the budget timeline, we are actually about midway through, right? So that third bullet, we're on the Senate Ways and Means, and then it will go to a full Senate vote like we just had in the House. And then we still have conference committee before it gets to the governor. So we're, you know, about halfway, maybe a little less than halfway through right now. So super important, but we're making good strides already. So I think one of the main things that you'll see in our ask, and that's part of our action alert, is this request to maintain the governor's investment of $390 million plus the $95 million from an economic development bill from the past sessions, which brings us to $485 million, which ensures that the direct support salary rate will go up, like I said, to, you know, an average of $20 per hour, and hopefully not much less than that. And we do believe that that will move the needle and bring more possible recruitment, hopefully allow us to have less turnover as well. And the reason why we, you know, are celebrating this, even though we know we need probably closer to, you know, $24 an hour to really make an impact, is you can see the huge increase that has happened just since 2021, right? Much needed increase. So I think people, you know, some people are new on the call, and we do go over chapter 257 a lot, but just for folks that it's new to, you know, this is basically the mechanism for which the rate increases will happen. And so the money goes into the chapter 257 mechanism, and then the rates will be set for the coming year. Now, this year, the rates are really affecting residential services because it's every other year, which I think is sort of shown in this. As you can see, in one year, it's residential, and then in the next year, it's more focused on community day and employment and family support, and then back to residential. And this year, we're on the residential. And so we're really happy to see this kind of an increase, and happy that the House has seen the need. Given, you know, going into this budget, there was a lot of talk about the revenues in the state not meeting, you know, expectations. And so there was some concern. So having us all, you know, the one thing I will say is right now, I feel more secure about our ability to affect this budget through advocacy than I ever have. And I'll tell you one of the reasons why in a minute. Just our line items had a $134 million increase, so additional funding through the governor, and the House maintained all of those, which is great. All of those key line items: transportation, residential, day and employment, respite, all of those. Again, a little bit more on the messaging here, but what I wanted to remind people is the House also stepped in to help us turn around the Mass Health cuts to the PCA program. So there was a lot of advocacy done on this from many organizations, including the ARC. But really, this is what really makes me think that our voices can really shift things. So this was a significant cut to the PCA program, where it would have affected over 6,000 individuals, cutting PCA hours and cutting meal prep time. And the House was able to go in and make language changes and basically stop Mass Health from making these cuts. So that was really good news. And thank you to everyone that participated in that advocacy. We also saw the House, in such a, another advocacy coup for us was, that we sent out, again, 500 letters to support Operation House Call Amendment, which will allow this program that trains medical students and nursing students and other healthcare professionals on providing inclusive healthcare and best practices to people with autism and IDD. And so the House, we had over 60 co-sponsors on our amendment, and it passed, which was great. And that was Chair Lon who filed that for us. So that's all good news. And we need to replicate the same on the Senate side. So that we're already off to a good start. So the legislation piece, I want to jump into now, but maybe I do see a few questions in the chat. So maybe before we.
Yeah, there was a quick question on whether or not the increases in the budget will benefit people doing self-direction as well, so they can pay their DSPs more per hour.
Yes, all the DDS employees are going to benefit from Chapter 257 increases. Mass Health is a different story. The day HABs and the day programs and the PCA and the AFC, that all comes through Mass Health. But DDS employees will benefit from Chapter 257.
One of the other comments was in agreement with getting more powers and number to go to and advocate for things. So they're all in agreement with that, which is great. And the first one actually is interesting because it's basically saying that someone's AI secretary has been turned on to capture the information. So
fantastic. And you will have access to these slides as well. We send them out after. This is also recorded too, and it's popped up on our YouTube channel. So that'll be helpful. So yeah, so I hope people are comfortable with the budget. So we'd really try to make it simple in terms of our ask, which is also available on our website, but we can, maybe this time is a good idea if we email it with the slides, because it is telling the Senate exactly what we need. We need them to support the workforce. We need them to support the DDS line items. We want to make sure they do exactly what the House did, or turn around those PCA cuts in some way, shape, or form. And when that budget comes out, we'll see if there's any need for amendments, which we'll try to engage you in as well. But okay, so that's the budget, and then we're in that really interesting time frame for bills as well. So as you know, legislation is a 2-year cycle, and we are coming up to the end of our 2-year cycle. And it's been on a long cycle with a lot of bills. Bills that, we worked on getting co-sponsors. You all jumped in to ask your rep and senator to co-sponsor bills. They were assigned to their committees. We had dozens of hearings, and people came in and testified, and they zoomed in. We had Joint Rule 10 in February, where a majority of our bills were voted on. But at that time, a good chunk of our bills were also put into extension. So that makes it difficult because, it's hard to prioritize a bill that's not moving out of committee. So we did have a lot of bills that did move, and we'll talk about them. Right now, we have a bunch of bills in front of Ways and Means, which means they're in a really great position to pass. And we have a couple others in rules or third reading, also in position to pass. So let's look at those bills, and I'll see if and you can see I highlighted expanding Nikki's Law, which has been one of our top priorities all along, and it continues to be. When this bill moved out of its committee, it actually combined with another bill. And it's a nice, strong bill to expand Nikki's Law to DAHAB, but also to strengthen the regulations around the abuser registry that I think everyone's pretty familiar with. And then we also have our hospital training bill in front of Ways and Means in a really good position with a whole lot of support from the medical community. We have Children's Hospital on board and Boston Medical Center also advocating for this bill. We'll be having a legislative briefing in May. So we're really going to be pushing these top two bills. And Jose, I'm going to let you jump in, but I just also
Yep.
wanted to just acknowledge the blue envelope also being in Ways and Means. As I think all of you had heard, it did pass through Senate Ways and Means, but it's still in House Ways and Means. We're calling this bill a win right now because even though it didn't pass fully out of the legislature, it is rolling out currently in Massachusetts. And it is, you know, a tool for autistic drivers and for the police. And we're really grateful to see the state police adopt it and mass.gov put this out as a statewide initiative. So, so yeah, very, very glad. And you know, if the House feels like they want to move that bill as well to really mandate and codify, that's great. But we do feel like, you know, it is rolling out, and that was the purpose of our advocacy. And the last thing I'll say is on universal changing tables, which is also in Ways and Means, which is great. It's just that we do need to work with the committee on language on this bill. So those are kind of the bills that we're working on in Ways and Means right now. And
Yeah.
you want to
Yeah.
jump in, Jose?
Yeah, just briefly, I would say that, I mean, because you covered it so well, but I would say on the left-hand side, I think the majority of those are House Ways and Means. So right now we still have 7 bills with House Ways and Means, 4 in the Senate Ways and Means, and then kind of the other, 7 or 8 or so are kind of an extension. With a lot of the extensions, kind of a couple being due today, but we're still waiting for information on those, so we're still following up. A few more in June and one all the way out until July 10th, which is seems kind of beyond the range, but still that's kind of what the extension period is. So I would say, yeah, there's still a lot in play, a lot of advocacy to do, but still it's more waiting for information to come out of the different committees.
And I would say if one of these bills or any of our other bills that you've been following, you want more information on, just because a bill is in extension right now doesn't mean that it can't come out at any day and make its way through the process. I mean, it's less likely right now that we're going to see these bills that are hanging in extension have as much of an opportunity, but we've seen it in the past where they come out, they've been changed in some way in their committee, and now they're ready. So if there's a bill here, or if anyone has any questions on the bills that we have up or we
Yeah.
don't have up.
Patty had a comment. Patty Duffy had a comment on timing for communicating before the Ways and Means. So I guess, I don't know if you mean timing for us to interact, or
Yeah, do
do
you
you
want
want
to
to
unmute?
clarify, Patty?
Okay, that's all right. Well, so I do have one piece of bad news to just share because I just checked my email, and it looks like ABA for adults is going to study this session, which is too bad because there was a whole lot of advocacy done on the ABA bill. And we talked about this mass health kind of budget concern and the way they're reaching out to cut PCA services. I think a lot of our bills that would be would have a cost included with them that affected mass health, we may not see move this year, given those concerns about their $1 billion budget loss. But so we'll put out something more formal on the bills that were in extension and were up today to give you some information, more information on that. But okay, anything else in the chat on the bills? Oh, timing with
I
sorry.
guess she's asking what time for
Timing for
meeting.
meeting
Oh,
with
meeting with
senators.
senators.
Yep. So right now is the perfect time. Literally, you have the ask, the bills, the budget is in front of them. If you have a bill that you're interested in too, you can hit your reps and your senators right now. But for the budget, I'd say, yep, now's the time certainly to meet. And sorry, I just wanted to also say we still have plenty of other bills on our advocacy platform. So if there's something we didn't mention today, and you want to check it out, please. Jose and I are tracking, an additional probably 10 bills on there. So let me stop my share so we can get to a few more questions. I know that was a lot of information on the budget. Some of it was probably repetitive to some of you, but maybe new to others. So again, feel free to reach out if you need additional information, or feel free to unmute now with any questions. I'm really grateful for the number of people who are participating in engaging with their reps and senators. And it's just amazing to me when I'm walking through the State House, how I can hear our advocacy at work. Staff is asking for numbers and data to try to get understanding and get behind issues. And they really do want to hear your stories and they want to help. So, definitely feel free to reach out. And I think we said this at the legislative reception, but nobody's really reached out around this. But if you want more help, to write your story, or, just kind of a little more step by step on how to approach your legislator, we're here for that. And we're updating our tools on our website as well. So hopefully in a week or so, you'll see kind of a more broad advocacy toolkit that you can also access. And I don't know, I think the last thing I'd say is, make sure you're pulling in as much of the folks in your network as you can as we get closer and closer to the end of the session. Anything else, Jose, that you would add?
No, just to reiterate what you said about, telling one story, how powerful that is. I've been kind of in this advocacy space for my son for about 20 years now. So for me, the stories are very well formed, and I've had many chances to kind of say them. So I think, as you said, with someone who's kind of newer to it, we're more than happy to share our experience and how you kind of get your story to be its most effective self in a short, kind of concise way. So feel free to give the office a call or send an email. Happy to reach out and connect.
And Jose is really interested in connecting you all, because it's easy for us. We can see who's in, Senator Cream's district, and how can we help you all get together and do more advocacy together. So
Yeah, I think expanding the grassroots kind of connections that we all have, then you really get into the real critical aspects of the issues. And so it's harder to do that as you get higher and higher, more up in summary. So yeah, I think I'm looking forward to that kind of process, and hopefully, a lot of people engage with it, because I think it's very, very, very powerful.
Jose, I shared your email on the, I mean, of course you can reach out to me too, Sullivan at ArcVast, but I think if you're interested in doing any of those connector legislative visits, reach out to Jose. Oh, Robin, go ahead. Sorry.
Yes, hi. I'm going to be going next Thursday, May 9th, to the State House with a group of self-advocates from our agency. I've got about 15 people, self-advocates. We went about 2 months ago, and I signed up for this today because we used to go under the auspices of Mass Advocates Standing Strong. They used to set up a legislative day once a month, but they don't do that anymore. So we're kind of on our own. And that's why I wanted to sign up for this, so I could see what the priorities were that the people would be interested in talking about. And so I just want to thank you for the information. And they love going there, and everyone is very respectful to them. And if you're nonverbal and you're just making some sounds, you're getting eye contact. And last time we went, one of the reps wasn't in the office, and one of the guys goes, well, where is he? And and it turned out he was in the hall somewhere, and when they were walking down, he saw them in the hall, and he went over and spoke with them. So he was very motivated. So I feel, people love going there because they do feel quite respected. And I thank you for the information that we will, see the senators and speak on the budget and these other
Robin,
issues.
that's amazing. I love to hear that. And I had recently had the opportunity to take a bunch of self-advocates around as well. And I felt the same way that not only was it just so educational to the reps and and senators and their staff, but that it really did feel very respectful to those self-advocates and that, no matter what level of communication they had, they were making an impact just by being there. And so if you want, I don't know if you have access to our budget ask, but that might be helpful to just have, and I can email that I'm going to email
I
that.
do have it.
Okay.
Because I follow you guys on, I get all your emails and all that. So
Awesome.
sending some things. So I already have printed some out. Actually, we meet monthly. And so last time we went over the budget using your paperwork, the DDS budget, so they could see how it pertains to them. And, it's
Wonderful.
good. I appreciate all your information.
Thank you. Thank you. Okay. So everybody do what Robin does. All right. Well, if anyone else has questions, okay, share the budget ask. Yes, absolutely. I'll share the slides and the budget ask. And then, the bills are a little bit more complex, but reach out on the bills if you have any questions. And again, I hope everybody has a great day. It's so nice out there. Maybe get some sunshine. All right. Thanks, everybody. Bye-bye.